myself, Dr. Manisha, Assistant Professor, Faculty of Physiotherapy Department in RPIIT Medical Campus, Karnal. Welcome to our YouTube channel in RPIIT Practice. If you like the content of this channel, please like, share, and subscribe. The next one is the now two surfaces, visceral surfaces and diaphragmatic surfaces. We can see in the two borders, three borders, superior border, inferior border, and intermediate border. And there are two ends, posterior end and anterior end. Ends. There are two ends, anterior or lateral end. The posterior or medial end, anterior or lateral end is expanded and is more like a border. It is directed downwards and forwards and reaches the mid-axillary line. The posterior or medial end is rounded. It is directed upwards, backwards, and medial, and rests on the upper pole of the borders. There are three borders: superior border, inferior border, and the last one is the intermediate border. Superior border is characteristically notched near the anterior, and the inferior border is rounded. Intermediate border is also rounded and is directed to the right. Surfaces, the diaphragmatic surfaces and the visceral surfaces. Diaphragmatic surfaces is convex and smooth. Visceral surface is concave and irregular. And the angles of the spleen, there are two angles: anterobasal angle, posterobasal angle. Anterobasal angle, it is the junction of superior border with lateral or anterior, and it is the most forward projecting part of spleen. When spleen is enlarged, this is felt first, so this is called clinical angle of spleen. Posterobasal angle, junction of inferior border with lateral or anterior end of spleen. Hilum. Hilum lies between superior and intermediate borders. It is biased by branches and tributaries of the splenic vessels. Relations. Peritoneal relations. The spleen is surrounded by peritoneum and is surrounded by following ligaments. First is the gastrosplenic ligament, extend from the hilum of the spleen to the greater curvature of the stomach, where it contains the short gastric vessels and associated lymphatics and sympathetic nerves. Second, the ilio-norinal ligament extends from the hilum of the spleen to the anterior surface of the left kidney. It contains the tail of the pancreas, the splenic vessels and associated pancreatico-splenic lymph nodes, lymphatics and sympathetic nerves. The phrenicocholic ligament is not attached to the spleen but supports its anterior end. It is a horizontal fold of peritoneum extending from the splenic flexure of the colon to the diaphragm opposite the 11th rib in the mid-axillary line. It limits the upper end of the left paracolic gutter, or it is called the sustaneculum linis.